Good afternoon, good evening, everyone, wherever you're joining us from today. We want to welcome you to the Nurse Policy Entrepreneur Café. We believe that nurses are well positioned to incorporate health in all policies because we're the first witnesses to all of the determinants of health, and we keenly understand that health system strengthening expands beyond traditional direct care roles. Nurses work in multiple spheres of influence to shape health and social policy that addresses problems in healthcare, including in the workspace, in government, associations, and in civil society at large. The origin of the word entrepreneur comes from the French language that denotes a person who undertakes a project. So this doesn't necessarily mean business entrepreneurship. This concept is not unfamiliar to nursing professionals, and societal changes have been initiated by individuals who have observed a problem and figured out how to disrupt the status quo and the equilibrium to improve something. And policy does not always mean politics, and deriving effective change does not always mean running for office to do so. A policy is just a set of ideas or a plan of what to do in a particular situation. The Future of Nursing report has a multidisciplinary call to action for nurses to assume leadership positions and serve as full partners in healthcare reform, from practice to policy, including in decision-making for national policy. And nurses must prepare to engage regardless of our practice settings. Nurses, as the largest constituent profession, have maintained our status as the most trusted profession for decades, yet we're rarely engaged in the process of healthcare policy making. The concept of nurse policy entrepreneurs, while it's been practiced for centuries, is often overlooked, and this gap is not only from our invitation, but also our struggle to identify as thought leaders in this arena. So, becoming engaged as a thought leader and policy influencer is an element of our professional identity, with the beauty of diversity in our individual perspectives, personalities, and leadership roles. If we leave it to other disciplines to determine healthcare policy, whether they are healthcare providers or not, reform will be marginalized. We must become known as more than just the trusted profession, but also as the most influential when it comes to policy. We share this experience from nurses to nurses, and we share our dialogue about it. The implications are just that, at the very least, you as a nurse policy entrepreneur walk away from each cafe with a little bit more understanding about steps you can take to make an impact. We seek to empower nurses as influential advocates and full partners in healthcare reform, translating advocacy to policy. After dialoguing in our open-door, judgment-free space, using our resources, and diving deeper into your why, we as nurses can build upon our practice of advocacy out in the world and in broader engagement. So, let's get started.
We're going to be diving into our recently published article, The Nurse Policy Entrepreneur Café, Redefining Nursing Identity. This paper really explores how the NPEC model helps nurses reclaim that identity as a nurse policy entrepreneur. And today we're going to explore some of those key themes that we examined throughout the paper, including the history of nurse policy entrepreneurship, barriers to nurse engagement in policy spaces, and the growing role of nurses as advocates, innovators, and full partners in healthcare reform. As Grace was saying, we're also going to share more about how the NPEC was developed and those ideas that help shape its collaborative, dialogue-driven approach, and really our vision for the future of nurse policy entrepreneurship and kind of the things we have planned. I'll go ahead and start introductions of our speakers today. So we have Michael Polacek, DNP RN RET. Michael is a nursing professional and healthcare policy advocate with more than 5 decades of experience in mental health and correctional settings. A nationally and internationally recognized presenter on suicide prevention, trauma, science, and the nursing role in health policy, he has served on multiple nonprofit boards and founded the Nurse Policy Entrepreneur community in 2022. Grace Kissner is a board-certified critical care registered nurse with extensive experience in healthcare and promotion since 2007. Her passion for global health, sustainability, advocacy, justice, and empowerment drive her approach to health and all policy. As a highly driven thought leader and innovator, she advances solutions that serve diverse populations while elevating the nursing profession worldwide. She is cross-sector credentialed, multi-degree awarded, and educated across 4 continents, and her leadership has facilitated international clinic teams, bilateral learning exchanges, strengthened advocacy efforts with the United Nations affiliated organizations, and informed pivotal policy reforms. She also serves on multiple board leadership councils and advisory panels, providing strategic insights and mentoring in the next generation of health leaders. And I will briefly introduce myself as well. So my name is Ongelique Conflenti. I'm, excuse me. My name is Ongelique Conflenti, and I am the program coordinator for the lung cancer screening program at Weill Cornell Medicine. In this role, I lead community outreach and partnership development for our health screening van program, which is an initiative aimed at reducing barriers to care and expanding access to lung cancer screening across New York City. I'm deeply committed to advancing health equity locally and globally through nursing excellence, advocacy, and policy engagement. I'm also very passionate about global health, climate action, and sustainable development, which really drives my work to create a healthier, more equitable world. I've been a co-facilitator of NPEC since about 2024, and I also serve on the board of directors at TIMI Global Health. Okay, so to get started on our session for today, like I said, we're going to be going over some of the key themes in our recently published paper, the Nurse Policy Entrepreneur Café, Redefining Nursing Identity. So this paper was actually published in January of 2026, and our authors include Grace, Michael, myself, and also Dr. Nina Beeman, who is joining us today, and Eleanor Lang Abraham, who is not on the call today, but we really appreciate her efforts and input as well. We did publish this paper in the Interdisciplinary Journal of Partnership Studies, or IJPS, and this journal was developed through a partnership between the Center for Partnership Systems, University of Minnesota Libraries, and the University of Minnesota School of Nursing. And I thought, we kind of submitted this paper to a couple different journals and systems, but I'm very happy we landed on the IJPS because it really aligns with a lot of our values at NPEC and kind of what our goals are for the future and the kind of community we're trying to develop here. So I really wanted to briefly just touch on the idea of partnership studies and what the journal defines that as. They define it as an emerging interdisciplinary field inspired by Albert Einstein's observation that no one problem can be solved by the same kind of thinking that created it, which I think that's really, intuitive to what we're doing with the cafe as well. Partnership studies analyzes social institutions and beliefs from the perspective of where they fall on the partnership and domination continuum and illuminates how they affect all aspects of life, social institutions, family, education, religion, politics, economics, mass media, and draws on that interdisciplinary approach as well from natural and social sciences and humanities. Really, it's designed to bring people together to share knowledge and experience with one another, to develop new fields of inquiry, and provide those practical tools to address our personal, social, economic, and environmental challenges. And overall, really providing individuals, organizations, and communities with the language and actions to help move them toward partnership. I thought it was also really a lovely timing and kind of aligned that we submitted our paper under the theme for the issue called Transitions from Old to New Models. We're going to be jumping into the idea of a nurse policy entrepreneur and the history of that in our profession, but the idea that we are still playing that key role in the past and bringing that into our future of the profession as well. And one thing, again, that we really, really appreciate about this journal in particular is there are no fees for authors to publish articles in the IJPS. There are no fees to access any of the articles, and articles are viewable immediately upon publication. This really aligns with our values of accessibility and not contributing to a pay-to-play system where there are a lot of barriers and closed doors in order for nurses to access education about policy and advocacy engagement. And I will pass this one over to Grace.
Thank you. Yeah, so just at first, the reason why this matters so much for nursing is that imagine if you had just from the US, because right now the people of us that are in the room are from the US. We've got, I think, 330 million people in this country. What if they were all able to give $1 to something? Can you imagine what would we do with $330 million, right? That's just one small single contribution from every person that is together underneath an umbrella of something, right? So underneath the umbrella of a certain national citizenship, one small individual contribution. Nurses have the power to make that one small single individual contribution, even if that's all they do one time, to have a huge impact if we do it collectively and organized. There are over 29 million nurses and midwives in the whole world. We're the largest global constituent profession, and we also make up the largest part of a huge workforce in healthcare. And we don't necessarily track this across the world, but in the US, we have a Gallup poll that I think we've actually now surpassed this 24 years in a row. We have been proven to be voted to be the most trusted voice across other professions, right? That's right up there with doctors. But you know who's at the bottom of that? Are car salesmen and politicians. You always think about like the typical like not prototype, the archetype of, the sleazy car salesman. They're just going to try and get anything past you. And a lot of people, and I think especially now, don't really have a lot of trust in government. And that doesn't really matter what side of the aisle you sit on. It doesn't really matter what your context is. In 2024, as we were writing some of this paper, that was a super election year. There were over 70 countries had an election, but only like 38% of those had an open, fair, free election, meaning there was real democracy. And from a US perspective, it doesn't really matter like if you think that we don't have as much democracy now, because we do. We really do have a system that's set up that has these structures in place. And that means something that matters. But what's crazy is that because nurses are so busy all the time, despite being the largest profession, we don't have that protected time to go vote. We have to find other ways to really make sure that we do that. I think we should. I'm not saying we shouldn't, but it's not the only way that we can engage with policy. And when we find people who can help mentor us, who don't necessarily have to have the exact like-minded thought about a specific hot button issue topic, we don't have to agree on everything. You put 4 nurses in a room, you'll come out with 5 opinions. But when we work together to understand how we can engage, and that is the point of this community, this nurse policy entrepreneur community, we can learn from each other and find different pathways to engage at any level and with any amount of time commitment to advance policies that we really truly believe in. And the reason that we're so good at this is because we are trusted. We can walk into a room. We don't have red and blue gowns. We don't say, how did you vote? Or what do you believe in? And then choose to take care of you. We just do this. We walk into a room and we are on the front lines with you. We are experiencing a first witness of the human condition, of what brings that person into that room at that moment. Usually one of the most difficult moments in their lives, in their families' lives. But we can find that shared value across no matter how you approach your own health, what health means to you, what family means to you, and provide that care. And that is why we're trusted. We are there for you. And when we know what humans need, when we protect the most vulnerable, when we uplift communities, that's what we bring to political rooms or policy rooms, because political and policy don't necessarily always mean the same thing. They can, but not always. And this is why, with this insight, with this trust, and with the large amount of people in our workforce, when we come together in an informed and organized way, we really can make that impact. And we see this all across the globe. Ongelique was so great to include some studies that supported this. The fact that we're underrepresented and why we should be more represented in policy and decision-making spaces around the world. We included studies in this paper. There was one that was conducted with nurses in Jordan, Slovenia, Thailand, the USA, Iran, and across Africa that confirmed the lack of our presence in this global phenomenon. And each study reported low rates of nurses' involvement in health policy and identifying similar barriers as to why we have that lack of engagement in policy. The WHO State of the World Nursing Report that we've got up here on the screen stated that only 66% of responding countries reported the existence of a nationally supported program to develop nursing leadership, research, or policy leadership skills and literacy skills. Moreover, these leadership development programs were reported in only 25% of low and middle income countries. This is really personally an issue, a point, a small topic in this broader conversation that's really important to me. This is actually the focus of my master's dissertation that I'm currently working on right now. From The very front lines are pre-service education, where we start to get concepts of leadership and build that foundation. Once we get into our workforce, we have these really clear tracks of what it means to become a leader in clinical spaces delivering care. But we have the foundational understanding and the experience that we gain, these skills to lead in bigger and broader ways for communities, for systems, and for nations. But what we don't do, and this is all the way up to the national, the government level, chief nursing officer level, we don't have that organized support and education to develop these skills or to translate the skills that we have into policy engagement skills. And I'm just going to pass this over now to Michael, because he's going to talk a little bit more about those barriers.
Yeah, when we first started the cafe, the first 9 or 10 sessions was simply on getting together and discussing talking about the picture of the nurse as an entrepreneur when it comes to policy development and implementation. And we talked about what our personal barriers were, what we thought were barriers, as well as enhancers, what made us strong. But as I read other articles and looked at how other professions looked at us, it was clear that there was a very narrow view of how folks interpreted what the role of the identity of the nurse was. They saw the nurse as, well, too, you think of Nurse Ratched. You think of that old nurse who's in charge, everything's very controlling and all that. And that lingers. And there was still, if you look at the media, there's still really a narrow interpretation oftentimes of what the nurse is. But it's always at the bedside. It has to do with that. And professionally, other professions look at the nurse as that, great at the bedside, great with the patients, do the doctor's bidding. If you've ever read Nightingale's Oath or the Pledge, part of it is, hey, you're here to help the doctor, so do your duty. And we started, and I co-authored a paper discussing the initial educational foundation for nursing, which was simply vocational. And it started out with us being a tool of the doctor. And that was simply because physicians took the Nightingale model from England, brought it to the US, and for decades, the doctors determined what the curriculum was. The doctors determined what the role was. So for eons, for a long time, the role of the nurse was constrained to being a vocation, just doing the work of a bedside, which is, we do nursing things, but it wasn't as a profession. And so I think there still lingers. People don't understand the role of the nurse as a professional. And that's something we have not communicated very well. If you look at the scope and standards of practice, the book that we all should have at our bedside, the first 6 standards are the nursing process. It's how we do our job. But the other 12 or 11, depending on what specialty you're in, have to do with the nurse as a professional. In fact, they're called professional performance standards. Even nurses don't understand their role as a profession. So I think the barrier is our own, that we've constrained ourselves with, and we just haven't done a good job of expressing what that is. And some of that has to do also with our presence in those other venues. Are we at the table of policy making? Are we talking to legislators or city hall? Are we talking to people that make those policies, expressing how where the rubber meets the road as far as healthcare is? And I don't think we are. So it's something we haven't done. So I think that's something that I'm not sure how to change that. It's one of the reasons why we started the cafe, is to see how we can change our own perspective of that. Some of that's education. I don't think we're taught in our academic preparation on what our real identity is and how it applies to policy. So I think there's a lot of work to be done. That could be a conversation that we could have here too. And as I'm talking, if somebody has a question or wants to throw something in, please do. The cafe should be a cafe. It should be like we're sitting around having a cup of coffee and say, hey, I think this, and we should interject with one another. So if you have a thought, please interject. It's not interrupting. It's contributing. So there are institutional hierarchies. Nurses aren't seen as being part of that. Typically, if you look at I remember looking at in Oregon. We came from Oregon. The one of the advisory boards had for mental health had 18, 19 people on it. There was maybe one nurse, maybe. There was an optometrist. There's all kinds of other people, but just not nurses. So in the governmental system, nurses aren't necessarily acknowledged as a critical piece in that. So that's a barrier. Our voice isn't heard. And so I think we have to intrude into that. I don't think we should wait until we're invited. I think becoming part of that, we are part of it. Whether we decide to engage that or not is up to us. And I think to do that, a person needs an internal drive. You have to have a real serious why. You have to have a motivation within yourself to do something beyond the work of a nurse, because we're nurses 24/7, and it's not just at the bedside. So that's something that I think we all should examine ourselves for. Confidence. If you don't know what a thing means, how can you contribute to the conversation if you're not really sure you have the right stuff to sit and to have a conversation with administrators or with the people that have those meetings? You look at state administrators of healthcare, of health systems, or administrators of the government system. They sit at meetings all the time and talk to one another. They're comfortable there. We're not necessarily comfortable in that environment. So it's something that we need to change as well. Mentorship, we don't help one another necessarily. We're kind of on our own. And I don't think nurses have done a good job with one another. I wouldn't be where I am without some mentorship. Now, part of that is my wife. I saw my wife acting as a nurse, and I thought, wow, that's really something that I would like to attain to. And Nina talked me into advancing my education. I knew there was no way I could earn a doctorate in this. I wasn't smart enough. There was no way. And over coffee, she encouraged me to do it. And so there's a mentorship that I think is critical for us as we gain not only confidence, but skill sets. What is it how can we best develop ourselves? We can't do that in a vacuum. We need other people. We need role models, and we need the help of one another. So making ourselves available to one another is very important. Time. Who has a time? You talk to a nurse. Well, how come, why aren't you involved? Well, I got to do this. I got to do that. After I do my 12-hour shift, I don't want to do anything. That's understandable. So how do we expand the capacity that we do have? How can you spend 2 hours a month? Can you do that? Well, you can't really make that happen if the why inside you for that issue that burns inside isn't strong. If it's not strong enough to drive you, then you're not going to have time. You have other things that'll go in the way. So that's, financially, you can't contribute or participate in associations without money. You got to pay. It's all pay to play. You can't get education from a nursing organization without paying for that. And that always irked me. I always thought that just seemed to exclude a lot of people. And if you want to go to a conference, all right, well, that's $2,000 out of your pocket. Not everybody gets their organization to pay for that. So people are excluded from one of the greatest ways to develop through conferences, meeting other people and talking to other people, seeing what people are doing. It's just too expensive. How do you pay for that? So there's development opportunities. To me, a leadership role happens at every level. If you step on the floor and you have a CNA, you have everybody around you. We are nurses and we are leaders, so we're in that role. I think maybe we don't envision where we belong. Maybe some of the time we certainly could run an organization, an NGO, simply because we have a lot the skill set that it takes to run an organization. We know how to develop relationships. We know how to identify problems and solutions. We have the skill set. So I think developing their leadership development is more acknowledging the skill sets that we do have and being able to generalize those. Now, a nurse probably would do well running the city council. That's a leadership opportunity. We have the skill set, but we may not see ourselves as having that. So I think the limitations, the restraint is self-applied. And then policy education, as we move on to graduate, postgraduate education, that becomes more available, but it's academic. And I think there isn't the hands-on opportunity along the way available to us. There was a great group, the Nurse Internship in Washington, and it was powerful. It's weird because I became a nurse when I was 50. I was older, and I saw some of this stuff, and I saw it for the first time. Thought, wow, this is kind of a weird culture. It's a culture. It's a microculture. And it's just kind of strange. So there's a lot of questions I had about it, but I always have questions. I'm pretty disruptive, as my nature is anyway. So, is that on the slide, Ongelique?
Yeah. So I think that this conversation you guys are having is a nice segue into, where that culture kind of started, for better or for worse. But as far as nurse policy entrepreneurship, there's a history of that in our profession. And nurses have always been policy entrepreneurs, but we kind of stopped using that language. There is controversy around Nightingale. And for better or for worse, she is one of our kind of nursing legendary leaders here. But with nurse policy entrepreneurship, she really did recognize gaps in policy and practice and initiated what were then innovative approaches to care. And made quality improvements by reducing mortality rates and analyzing statistical data, supporting changes in policies procedure during her time, really using data and systems thinking to influence reform. But what we really want to focus on, and what we also included in the paper, was other nurse policy entrepreneurs that were doing very similar work in the same time frame, but did not get the big Nightingale spotlight, but who are doing equally significant, if not more, significant work, especially for historically marginalized and vulnerable populations, even back all the way in the 1800s. And that's definitely what we wanted to highlight, including the work of Mary Seacole. Again, in that same time frame as Florence Nightingale, 1805 to 1881. She also provided care during the Crimean War, and established a hotel for soldiers near the front lines using traditional and herbal remedies. She was a Jamaican-born British nurse who provided that care. Lillian Wald, again, kind of same time frame, founded the Henry Street Settlement in New York and focused on public health nursing and advocacy for underserved communities. And it's interesting to go back and think that the roots of nurse policy entrepreneurship, the roots of our profession, and how we can really rediscover that identity as nurse policy entrepreneurs and continue that legacy, but kind of adapt it to our current times and what our current social, political, environmental issues that our populations face and our communities face are. But we're kind of Barbara, as you were saying, really continuing that in our role, understanding of the social determinants of health and the UN Sustainable Development Goals, all those different things that influence health on a broader scale, but then at the end of the day do trickle down to that local impact. And nurses have that impact locally and globally. So that's something that we always want to be in touch with where we came from, and look to the future of how we can continue that legacy of the shoulders of giants on which we stand. I always love that phrase. I bring that one into a lot of conversations, but it feels very true. Again, identifying as a nurse in rooms where, it's not, you're not necessarily expected to be. And there's some situations that, people can say, well, I don't want to lead with nurse because I might be seen as, from a certain perspective that we touched on before, of that narrow view of what nursing is and what you're bringing to the table when you identify as a nurse. But we really want to make sure that people are empowered as nurses and as policy entrepreneurs, and then all of that is part of professional identity and that confidence of stepping into these spaces as a nurse policy entrepreneur as well.
Absolutely. We're talking about, we're kind of around the periphery of talking about policy and politics kind of going together. And so just as an example, Barbara, I loved your statement about, the story you were told, because I think many of us have been told about drop the nurse. But I do appreciate, Ongelique, you talking about that identity, because we have to present ourselves that way to make sure that not only are we identifying as a nurse, because I think there are more nurses engaging in policy than we are visually seeing them. They're not visible because they're dropping that RN. But I was recently at a climate center policy summit, and I was introducing myself to a legislative director, and I didn't introduce myself as representing one hat or another. I said, I'm Grace and I'm a nurse environmentalist. And they're like, a nurse environmentalist? I've never heard that before. What does that mean? And so I had the opportunity to share about how we have so much to contribute in that space. And when we bring this back, Eleanor Roosevelt was not a nurse, but definitely a woman that was promoting humanity and human rights. And as our profession is female dominated, kind of going back to the slide about our barriers, I think this is one of the barriers. It doesn't matter if we are a nurse or not. If we're female, in some rooms, that means you don't have legitimacy, even if you have the title, even if you have all the knowledge and experience. And how that relates, back to this kind of conversation is the global and local level, right? So even just describing and helping nurses understand their identity, reforming their identity in this space. We can talk about, again, how the UN Charter overlaps with our code of ethics. And this is two things we've talked about already today in this room. So Eleanor Roosevelt was the one who made sure, basically, from my perspective, that the United Nations happened, and establishing that charter from a human rights and patient, from my perspective, but person-centered focus. We give person-centered care, overlapping our code of ethics with that UN Charter. If you really understand the development of the UN from post-World War II, how it was created, and the global geopolitics, what happened over those decades up until the point we are now, how we've maybe in some ways come full circle. I don't know if that's a good thing, but in parallel from the 1940s to today, over the past 80 years, how global geopolitics and capitalism versus socialism has direct parallels to how certain countries have developed their healthcare system, social healthcare systems versus capitalistic or for-profit or revenue-generating health systems. There are real, true parallels. But what we're seeing in the UN side is how are we engaging in civil society? And from the healthcare standpoint is how are we engaging our communities as care delivery leaders? And so if you understand and you explain that history and how things have come about and why things happen from tropical medicine to international health to global health, there's really big differences between those three things, but it all is interconnected to the global geopolitics of every decade going forward from World War II to now. And so you really have to understand things outside of the healthcare sector, outside of your clinical walls, to realize how this is really affecting communities and how you redefine your identity to develop as a leader with a nursing lens, to have health-centered policy, but outside of healthcare spaces that we're traditionally seeing as more clinical spaces. So Angelique, maybe that helps you lean into the next slide.
Yeah, perfect. And the idea of what is a nurse policy entrepreneur? What does that look like? What does that look like in today's world with these different avenues of engagement? And the idea of a policy entrepreneur has actually been around for a while. The nurse part has not always been as at the forefront, but it's really a role that can analyze, explain, and reform policies, and we're adapting that to our different areas of influence. And these are just some of the key kind of roles of a nurse policy entrepreneur: identifying healthcare issues, drawing on that firsthand experience within the healthcare system, that very patient facing, sometimes interaction, the knowledge of those patient needs in healthcare delivery, and also safety concerns, bringing that expertise into the conversation and developing solutions, those evidence-based solutions that address those issues head on, collaborating with fellow healthcare professionals and policymakers, again, to formulate effective policies and initiatives as well. Advocacy and lobbying is huge. The identity piece as well is as a nurse policy entrepreneur is really goes in hand with the idea of an advocate as well. And that's something that, this group's heard me talk about, but, a couple of years ago, I did that Global Advocacy Academy with Sigma. And until that point, which is it's beyond my comprehension, I did not identify as an advocate. I remember I was filling out the application for that, and it was, what have you done, in advocacy? I'm like, well, I've advocated for patients' needs at the bedside? Question mark? I didn't, in my head, it was a question mark. But it was that kind of light bulb moment for me of identifying as an advocate. And actually later that year, or even Grace, I think the next month is when I learned about the NPEC. So then that was kind of a vacuum for my identity formation around a policy entrepreneur and an advocate and a change agent and a systems thinker, all these things that had not come into my consciousness until I kind of got into these areas where nurses were identifying as these things and feeling empowered to change the systems in which they're living in. But doing that through advocacy and lobbying, engaging in advocacy efforts to promote our proposed policies for these hot button issues that we're passionate about, meeting with legislators, healthcare administrators, and these other stakeholders that have, again, that influence, that power to change things that we don't always necessarily have. But when we have those conversations and we explain, the merits, the pros and cons of these different, issues or proposals that we have, and we garner their support. We're those trusted messengers in that room. And we can really speak to, the needs of our populations, our communities, but also those more upstream factors as well. So we're good communicators, good facilitators, and can do that in a variety of settings. A big aspect is raising awareness, using our platforms, our networks, whether that be in home care or global health or, maternal health, globally, locally, using our platforms and networks to raise public awareness of those healthcare related issues and building a broad base of support for policy changes. With nurses running for office, you don't always have to run for office in order to engage in policy. But, that is one way to really use that platform to promote policies that we hope to see change the world, change our communities for the better. Public speaking, writing articles, op-eds, letters to the editor, engaging with media outlets and social media. LinkedIn is a huge opportunity for at least engaging with other healthcare professionals, other professionals in general. But I think, it's important to also, leverage and balance that digital communication with the human connection, with going to speak to your legislators and speaking with your community as well. And I've touched on this, but collaborating with a variety of different stakeholders, really that truly interdisciplinary approach within and outside of healthcare organizations to ensure those policy recommendations are well-rounded and practical. And all of these things, as I was writing this slide, as I'm saying it now, these are things that when you think about the traditional nurse role at the bedside, it's things we're already doing. It's just applying it to a different context, whatever context, you want to apply it to, but, raising awareness, advocacy, developing solutions. These are things you all do in a 12-hour shift, or hopefully, maybe 10, maybe 8, I don't know. But these are things that are automatically a part of our practice, collaborating with different stakeholders. And that monitoring and evaluation obviously is huge. Monitoring and evaluating the impact that our work has, that our policies have on our patient outcomes, on our healthcare systems, and overall healthcare and public health globally, and informing further adjustments and improvements down the line. And we've touched on this too, but education and training. We play a role in educating communities and other professionals, again, our legislators, about these issues, about different advocacy strategies, and really fostering a culture of policy engagement within the nursing profession. Really, in essence, nurse policy entrepreneurs use these skills to bridge the gaps between clinical practice, education, research, and policymaking. And that's really what we try to empower folks to see when they come to the Nurse Policy Entrepreneur Café and community, that you're already doing this work. It's just a matter of kind of changing the perspective on where you're doing it, and maybe more of that intentionality as well. Go to the next slide here. And I will hand this over to Michael to discuss the theoretical foundation of our NPEC model.
Thank you. There are a number of models that we think about, and theory is interesting. I never thought of theory before, thinking about theory, but the more I dig into models and the theory of things, how to understand a thing deeper than just doing a thing, I've become more fascinated with some of these theoretical thinkers. Now, Rosemary Parsi is somebody that I just, for some reason, I just jumped on that. In my mind, it just connected, but it's so different. And it's such a unique approach to thinking that it just, so as we developed the cafe, initially this was a cafe, it turned into more of a community. I dug into her community model of human becoming, mm-hmm. and the rhythmicity of how humans work, how sometimes we're one thing, and the paradoxical approach to life. Sometimes we're the teacher, sometimes we're the learner. Where there's these back and forth things that happen, and it makes so much sense to me. And so as we develop the community here, and as we talk to one another, developing identity was very important to us, and that was one of the concepts of her community model. What is the evolving that identity to maturation to where it takes on a form that's very clear and effective is important. It's not just doing things, it's understanding and articulating what we are. The picture of a thing is very important. Creating and community built, co-creating was a big part of this as well. As we talk to one another, we co-create the constant emerging now. Every moment is emerging in front of us. It continually emerges. And the co-creation of that is important in that we, by talking with one another, especially with people either we don't agree with or don't understand, we have a new understanding of reality. And it's that co-creation that's critical. And in these days, it's almost impossible to co-create with somebody who has a different opinion, because that opinion is so set in stone. It is, I'm sorry, you're wrong. And then the name calling comes out and the bullying comes out, and there's no art, there's no ability to evolve. And unless we're able to do that, there's no hope for the future. Because, as Grace said, if there's 4 of us in the room, we're going to have 5 different opinions. And as Wrigley said, the guy that invented the gum, he told his board once, he said, if 2 or more of us have the same opinion, one of us is not necessary. So I look for people who disagree. I look for, and as a scientist, that's the first thing that we do. We look for, the null hypothesis is where we start. If I'm going to prove something, first of all, my approach is I don't believe it. And I have to unbelieve it in order to prove it. That's the true scientific approach. And that, I think, is what we try and do in the cafe. We talk to one another. And sometimes, usually we're very cordial with one another. We don't talk about issues so much, so it doesn't come up. But I think that's an important thing to learn, how to have a conversation with somebody who disagrees with you or has a different perspective. So this co-creation is very important to community building. How do you build a community unless you're able to work with people who have a different perspective of things? And looking for moments of presence. The self-emerging now is important. And as we have conversations, it shouldn't be Michael just talking. There should be this presence where we are. Eleanor Langer, are you familiar with her, Barbara? Is that name familiar?
No.
The idea of presence, of being in the moment, is so important. And she did this great experiment. She was out of Harvard, and she has a great story. And it goes back even to the Stanford prison experiment. It's a great story behind her background. But she had this experiment where she took a bunch of people who are over 80, split them into two groups, sent them up to the up place in New York in two different resorts. Half of them went to a regular resort for like a month and a half. The other half went to a resort they completely rewired to appear and be in the 1950s. All the newspapers, radio, everything was back then. She found that because of that environment and the ability of them to be present in that time where they were comfortable, their immune system improved. Physiologically, they changed. Arthritis changed. There was all sorts of physiological changes as well as cognitive changes because of presence, being in the moment. Mm-hmm. So when you talk about the cafe, being in the moment, part of my thing is I always have, I rely on some kind of a drink, but also aroma. I always bring some herb. Like today I've got Thai basil. And there's different olfactory things that I think make your brain just a little bit more open to thinking broadly. And I always hope in these cafes that we're able to think differently when we leave. And to stimulate that different thinking is very important. And the other concepts that she talks about is moving and initiating. We're constantly discarding our old ways and creating new ones, and not relying on the past, but looking for this emerging now, looking for the black swan of things that we couldn't even have envisioned because of a new experience. And anchoring and shifting, sometimes we need to hunker down and make what we're doing strong, and other times we need to recognize that that's not the right way, and how can we adapt it and not be married to that way. Pondering and shaping, thinking about, contemplating, and then reshaping what we think in a community is critical. Otherwise, we just do the same thing we've done before. And oftentimes you see programs where when the person who runs it, starts it, they go away, so does a program. Shaping a program, shaping something should result in a program that is self-developing. It's not reliant on a person, but the program itself matures. And I love to see how this is going. Grace and Ongelique have been taking this on and developing this. I've been kind of stepping away a little bit for different reasons. And as they do this, the thing is just kind of growing in different ways. And it's just fascinating how the shape of it changes. And so Parsi, I think, was beautiful. The other theorist who was perhaps the first, probably the second nursing theorist was Hildegard Peplau and her theory of human relationships. That is powerful. And when you talk about her stuff, I've been getting into that this last month, reading about how to relate her, because hers was more developed as a therapy with individuals, but on a community level, it applies very tightly. And talking about how her approach, her conceptualization of changing things through relationship is powerful. So I've been looking at Peplau lately, and I'll probably write a blog on what I think of that, because I think that'll be really powerful. And the other thing that we do is the World Cafe method, which we can't do here so much. If you're not familiar with that, it's a gold standard for how do you have a group of people who don't know each other come together and have a conversation and identify and address a problem and come up with solutions. If you're not familiar with that, Google it. It's a great methodology for group conversation and problem solving at a community level. We've kind of tried to stick with it as best we can in the cafe, but lately we've just been primarily having presenters and conversation. But that's how this started. That's how it came to be. Part of that is when we started this, we lined up with this well. We had groups of 3, never more than 4. I found that through doing this, 3 people is a perfect group for a conversation. Mm-hmm. 1 person, it's really easy. 3 people, you get more done. 4 people, 5 people, there's always 1 or 2 people that never talk. And if you've been in a committee meeting and it's more than 3 people, You have 2 people, 3 people at most that talk and tell everybody else what to do, because 80% of people are more introverted, and having those big groups just doesn't work. And so with the cafe, the World Cafe method, we group it down to 3 people, and we have a specific question that we bring up, and everybody has an ability to respond to that. And we use graphical notes where people take drawings and you draw pictures, and there are certain methodologies to stimulate thinking and innovative ideas and collaborative thinking and co-creation. And it's a beautiful thing in person. It's wonderful. And then you switch tables after 15 minutes. Now, I don't know if you've ever been to a committee on these Zoom things and they go, we're going to break up into groups, and 5 minutes later, we're coming back. Well, 5 minutes, you've just talked about what your name is.
Yeah.
So we found that between 12 and 17 minutes is a good time for 3 people to have a good conversation. And then we change groups. And then we change some of this stuff up. So we'd have 3 rounds of that, and then we'd all come together in what they call a harvest. And we'd share all those ideas and throw them up on an affinity diagram. And then we would sort all those things out, come up with categorization of our thoughts, and then start looking at some of the solutions. So anyway, it's a critical, you could see how we did our first, we used I forgot the name of it now, we haven't used it in so long, but all these little things on there were like little virtual stickers. You'd have an idea and you'd put up on the board, and then we organized them into categories. That's called an affinity diagram. If you probably used those things before.
Yeah.
So we did that the first 9 or 10 cafes was basically drawing a picture of what the nurse policy entrepreneur looked like, and the next 5 or 6 was based on, now that we know that, what can we do in the cafe to promote the development of nurses as policy entrepreneurs? So we really stuck with the cafe model. Since then, we've been doing some other things. We're trying to expand the website to provide education and networking. And then we have these we will have somebody come and speak on a topic. We've had a number of, if you haven't looked at our videos, you see the different people we've had on there. We've had national lobbyists and legislators and aides and different people, just people talking about different roles that were related to policy development. So that's that's kind of the cafe part. So yeah.
And that part of it was key. And this goes more into that identity development that we were just talking about as well, that structured group mentorship. And really becoming full partners in health reform by developing those knowledge, skills, and abilities and that confidence. As that, NPEC has been growing and shifting and changing, then we really hope to become a compendium for nurses that are interested in policy, that when they think, oh, nurses in policy, let's recommend them to the Nurse Policy Entrepreneur Café. Let's have this community that's known, that they can come and talk about it. And it doesn't have to be someone comes every single month. It's been a pretty consistent group of about 3 or 4 of us who do show up on that regular basis, but we have people from all over the world just dropping in for a session, picking up some nuggets of wisdom and taking that and running with it in their own way. We really just want to make sure that we're there as that psychologically safe space for people to engage with these types of ideas. And even if they just come for one session, we hope that they can take something back with them. But really open to really nurses at all stages, nurses and nursing students at all levels and all settings, and really just hoping to increase that access to this kind of conversation, this kind of systems thinking, and really gathering those resources on our website for folks to dive into, whatever their hot button issue is or their area of development they want to work on. That professional development is really key as well. So not just talking about what is a nurse policy entrepreneur, but how do you identify as one? How do you become one? How do you work on those skills to be an effective policy entrepreneur and advocate? So we developed these NPE essential elements, and this is just a list of different skill sets that really contribute to that identity as a nurse policy entrepreneur. So we've talked about issue expertise, communication, civics, relationships, shared decision-making, policy-making, and technology, with all these different subsections, as you can see underneath. But we encourage folks to take a look here and kind of identify your strengths and weaknesses or areas for improvement, I'll say. As far as, I am really good at raising awareness, using my platform to, to speak on digitally, but my public speaking skills are a little bit weaker, and I would really love to be able to speak more confidently, to have that elevator speech, to be able to approach legislators and speak full chest about these things that I know I have issue expertise in. And so this is just kind of a baseline foundation of some areas that might just get some, the cogs going in someone's brain when they first come to the cafe of what they can work on. And we do have those resources on the website to hopefully help stimulate that growth as well, as far as some different tools they can use to develop those skills. We usually try to, make the connection between what our presenters are talking about to these essential elements to kind of, again, bridge that gap between the actual, ideas behind it to, how this person who's presenting is teaching us to use these skills, in action. We've had presenters talking about being a member of a board and talking about those types of skills involved in that role. We've had nurses who have media expertise talking about how to, advocate for certain things on television and things like that, developing those skills with communication and outreach as well. So very excited to continue kind of fleshing this out. I think this will continue to grow and change as the cafe grows and as time goes on, and our social society grows as well. But we added AI to the technology bit. That wasn't always there. That was a recent addition. So all these things that are just shaping the water in which we swim, the air which we breathe as nurses in healthcare and beyond too. And we also have a lot of different features of the community that, again, have been growing, shifting, changing, some more than others, which is okay. It is volunteer led. It's a grassroots effort. So it is the three of us for now. But we're always welcoming more people into the community, again, from across the world. So if any of these offerings, these features, or these essential elements speak to anyone who's listening, we are always looking for people to join our efforts here and really help expand the community and our offerings too. So always feel free to email us. But for now we have our monthly cafes. That's a huge pillar in the work we do at the NPEC. We meet every second Saturday of every month at 12 p.m. Eastern. And like I said, we usually talk for about an hour sometimes too, but really stimulating discussion. We have our Global Cafes networking map, which I'll actually let Grace take that one because she was the creator of it. Grace, did you want to give a little bit more context to the cafes net map?
Yeah, sure. I just wanted to have a place for people to visually see where we were all engaging from. So we, again, volunteer led, unfunded, just doing some free like background analytics to our website and our LinkedIn. We were realizing, for a majority of the time, we usually have maybe about 5 people join our call synchronously. Sometimes it's gotten up to 20, and it's not always the same people. So we know that people are interested in the cafe and the community and our content, but not always able to join. So when I saw on the background of our analytics that we had engagement from over 65 countries, I was like, where are these people? Why are they engaging? How do they find out about us? What do they want to know? What do they already know and they want to share? And so I wanted to create a space where people could visually see, because we weren't tracking people. We were just saying somebody signed in from XYZ country. That's as much information as we got. So without going to, solicit information about them or grow some kind of membership list, we don't have that because we're not managing a membership list. We're an open door policy. I just wanted a space where people could volunteer and choose to opt in to share who they are, where they are in the world, what they're working on, and just be able to connect that way. Because if I see somebody in Rwanda, for example, I might be able to say, oh, that person is part of one thing It's the only part in the country where that's happening. And maybe that would grow internally or internationally if there was a way to directly connect with somebody who worked on that same thing in a different region. The other thing we thought about doing, or hoping that I think one of my hopes was that would come from this is we don't have to have just the one cafe every second Saturday at 12 noon Eastern Standard US time. Maybe there could be regional cafes. What are the differences between nurses engaging in policy in North America versus South America, in Africa versus Europe versus Asia, all the different subregions of Asia? And that might make it more accessible for people to be able to engage synchronously, because that's real, just how Michael was describing the virtual way that you could have a cafe, or maybe expand the cafes into in-person events. How do you connect with people that are closer to your region, that understand the issues that you're working on more directly, and just be able to show up in that space and make yourself available, or to be able to be in a room and make your name there to say, hey, I need help. Can somebody help me on this thing? And I don't know how much it's really expanded. I honestly haven't checked into it for the past several months now, but we do have people around the world, and maybe it will continue to grow. And maybe that just wasn't the right way to make that cafe networking map grow. But it was a free, accessible platform. You don't have to register for it, so I thought it was low barrier. But that might change. That might happen in the future, and it may not be through this map itself.
And yeah, there are a lot of resources here, so it can be a little overwhelming looking at it all at once. And wait, there's a newsletter, there are blogs, there's a YouTube, and
Okay.
I know we got some offerings here. But our I'm really proud of our LinkedIn as well. I will shout out to that one because I've been managing that for about a year now, and very, very excited that we can connect on there as well, because I feel like there's a pretty robust community of nurses who are already engaging in that platform, and just kind of gathering all those people into one space that hopefully we post our we like we said, we record these presentations and post them to our YouTube page, but I also post them to the LinkedIn page as well, after we edit it and everything. Just Google Nurse Policy Entrepreneur Cafe. That's probably the best way to get to the website. I know it's a Google site, so it's kind of tricky as far as like the actual, hyperlink. But yeah, if you just Google Nurse Policy Entrepreneur Cafe, click the first one. That should be our website. We have all of our resources and links here on the website, but all of our social media, YouTube channel, Zoom registration, everything is here on the first page. So if you click register and join the cafe on Zoom, Grace, can you still see that screen, or did it? Okay. Then you can sign up for all of our upcoming cafes. Just put your name, last name, and email address. That's the only required information, and press register and join. And that should send a link to the cafe to your email, directly to your email inbox as well. As far as the LinkedIn, you click that in button there. It's not, well, let's see if it'll let me. There it is. It will take you directly to our Nurse Policy Entrepreneur Cafe LinkedIn page. And if it's not waking out, you can press follow, and you'll be automatically updated. There you go, on your feed for updates from us. Yeah, click follow there. Go to posts. Can see everything we've posted or reshared regarding nursing and policy, over the weeks. We always post our recordings of our previous sessions as well. You click this play button, that goes to our YouTube page. Our handle on YouTube is Nurse Policy Cafe. You could also just type that into YouTube and this will pop up. Go to videos. Our most recent recordings are sitting up here at the top, but we also have ones that go all the way back down to 2 years ago as well. And if we go to these other tabs, it has more information as far as where you can see our folks have done different presentations, different blog posts, our articles there. Thank you, Grace, for putting that up. That's great. Different presentations as well. Developments, our essential elements are here, and you can click on each one individually or go to this main page and click on these hyperlinks to different tools and different resources based on the essential element that you're interested in learning more about, such as public speaking, some information about that, some links, resources, organizations who are doing work in those spaces. We have our blog page as well. If you're ever interested in writing a blog for us, we would love to have you. Whatever topic of choice that is speaking to you as far as nursing and policy, we would love to have your voice in the conversation. And doesn't have to be very long, could be as long as short as you want. And usually try to provide some resources with our posts as well. Again, our speaker series here with all of our different presentations over the past couple of years. And this is the Global Cafes networking map that we were talking about in our session today. You click on Global Cafes. There's actually, Grace, did you put a video here of how to join? Yeah, great. So if you click this video, then it will show you how to get your name on the map here. There we go. But this is the map. And we have, again, all of our engagement from across the US, across the globe here. From the different individuals who have added themselves to this list. I think that's about it. Did I miss anything in your end, Grace?
No, it's just it's working for me because I checked, but it's not loading on yours. On our homepage, the link to the map is also there. Oh,
it's
now
right
it's
there.
showing up
Now
for
it's
you.
showing. Yeah. Okay.
So even if you have trouble navigating the top menu, you've got these first buttons here. The cafe map, the Global Cafes map will be that map a little there. The Gmail, the big M, that's an envelope. That's our direct link to our Gmail account, so you can email us. And then the Zoom link is also there in case that brown banner button doesn't look obvious.
Oops, I clicked the Gmail link and now it's being weird. Okay, yes. So LinkedIn and what's this one actually?
That's the Substack.
The newsletter. Yeah. So this is our LinkedIn.
Did you open up this Substack? Maybe people need to know what that looks like to sign up for it. That's our quote unquote newsletter. It's really just a once a month email.
This is our Substack newsletter, once a month email for the Nurse Policy Entrepreneur Café. And you can subscribe as well to that to get that automatically into your email inbox every month. So we have our LinkedIn, our Substack newsletter, if you click here, our YouTube page, our Global Cafes networking map, our Gmail, and our Zoom. That's a lot of resources.
That's right. It is. And I think the contact in the top menu also still has our email, as well as like a Google form fill out. So
great.
If the images work for you, if the links are working for you, great. If not, it's also in that top menu banner, that all the drop downs and different pages. So wherever you can find, there's multiple places to find the same thing on here.
They really are. But this is, speaking to what Grace was just talking about as well. She took a look at the background analytics, and the cafe grew exponentially really in 2024 and saw exciting expansion in 2025 too. That 28,500 engagements, that was as of I think December 2025. And that's across the website, video recordings, newsletter traffic on our Substack. And I have 60 countries here, but apparently 65 countries that we have engagement from. So really, really happy about that. And Grace created this map as well to kind of show the global reach of our community. And there's interest, and we're getting that conversation started, and hopefully, empowering some folks to see themselves in a new way. And we currently have over 600 followers on LinkedIn, which that didn't exist, over a little over a year ago. And the fact that, most of them are nurses, not all of them. We also have our allies in that space as well. But we have 659 followers from around the world. We can see the analytics on that too, who are at least interested in the idea of nurse policy entrepreneurship. So really, really happy that we can track this stuff. It helps inform our future vision and directions we want to go in, but also speaks to all the work that we've done to get here. So really, really exciting information. And nurses, I need data. I need some evidence-based approach to the cafe. Other than it just
to know
makes me
that
feel
we're not
warm and fuzzy inside. Yeah.
we want to make sure it's not going out into the ether, right? Like we need to
Right,
know, oh,
right.
okay, people do care, even if they don't
Yeah,
show up.
yeah,
So
yeah,
great.
yeah, yeah. It's not the only numbers aren't the only thing that, make it matter, but it helps solidify that in your head of like, okay, it's reaching some people. And as we talk about kind of our future directions and vision for the future going forward with the Nurse Policy Entrepreneur Cafe, um, it's something that I think we're still kind of envisioning. We've seen a lot of growth, like I said, in the past couple of years. We have a lot of ideas kind of milling about in our collective dialogue. As far as maybe mentorship programs, connecting again those people who are doing the work, people who are just starting to see themselves in that way. Maybe virtual internships, educational roadshows, policy roadshows, going to different nursing schools or other environments to talk about nurse policy entrepreneurship. Really want to help facilitate that global collaboration in a much more, intentional, meaningful, deeper way. Again, like Grace was saying, connecting folks who are in the same region, but also learning from people who live in different parts of the world of how they do things. I again would echo that in-person regional cafes would be very, very cool. I am personally based in New York City, and at least from our LinkedIn analytics, I see a bunch of people who are based in New York City. So watch this space. I would love to plan a New York cafe, but that's something that hopefully that global cafes networking map can also help us kind of facilitate too. There's the idea of pod classes or podcast classes that take the information that we're learning in these cafes and converting it into a different format that might be more accessible for folks, kind of short form format. But these are just ideas that we've been, bumping around. But sometimes it's great to have a fresh set of eyes. Yeah, we promoted it on our LinkedIn as our first kind of in-person NPEC meetup because we knew a bunch of nurses would be going to this Congress, and so we made a reservation at the restaurant that was right outside the conference center and had our first kind of in-person cafe. And that was this photo is from as well. So ICN Congress, and again, I think that's something where there's so much potential for the nurses who are already attending these events, who have these ideas, just connecting everybody so that we can have those conversations in person when we have the opportunity to. It's so when we do go to these conferences or congresses, members of our community, we like to come back and kind of give back to our community of what we learned, who we met, and what the connections we made in those spaces too. And that's something, again, it brings a smile to my face to see that photo because we continue to show up for our patients in our communities, right? And that's really the gist of our presentation. I wanted to say thank you for your time. Our call to action for anyone who's watching this video and our in-person or our synchronous viewers as well is that nurses have always shaped systems. We went over the history of nurse policy entrepreneurship and the ones who came before us who shaped policy in different ways. And understand that policy is broader than just politics, but that our influence as nurses, our status as trusted professionals, really does call us to influence in these spaces and to act in ways that we can. And hopefully, through that Nurse Policy Entrepreneur Cafe, we can help facilitate that skill building, that professional development, that community and mentorship space, that psychologically safe space for people to come and talk about, some of the challenges of this work. Because there will be challenges, there will always be challenges, but it'll always be work worth doing. And I really want to invite people to take some information from this session, identify one sphere of influence that you do have. Maybe engage in one advocacy action locally or globally, connect with other nurse leaders, and continue the conversation beyond the cafe. And that could be with, your children, or with your colleagues, with your boss, with that person on the corner who says what do you do as a nurse, and really just continue that conversation, keep it top of mind, and we are really excited to see where that conversation takes us all into the future.